All right, here with more now to answer your medical questions is Dr. Msonthi Levine. Thank you so much, Doctor, for being with us again on this Monday. You don't mind if I fill in, do you?
No, not at all. Absolutely.
I know Kelli
do a great job.
Okay. Are you ready to get going here? All right, what could be causing pain in my heel? It is only in one foot and usually is worse when it first get up in the morning or after sitting for long periods.
Probably some sort of tendonitis or bone spur on the heel, very common, normally can be treated with injection of lidocaine and steroids done by the podiatrist or the foot doctor. Sometimes they will recommend some shoe inserts. Very rarely will you require surgery. Anti-inflammatory medicines can be tried as well, such as Mobic or Naprosyn or Aleve over the counter.
Plantar fasciitis, is that more in the ball of the foot or is that the heel of the foot?
Yeah, more of the bottom part of the foot or the flat part of the foot, as some people would say. Yeah. Sometimes that can be the beginning of plantar fasciitis, but as it progresses will involve more of the bottom of the foot. Treatment is very similar. Okay.
Well, let's get back to I'm sorry, we kind of I jumped the gun on this. Lyme disease, is that very common in this area at all?
It is not, and as the segment mentioned, it's more in the northeast. We see it periodically, but certainly not as common as it is up there. It has to do with the ticks. Certainly people spend a lot of time outdoors here. I probably have only diagnosed one or two in my short career, so it's not common, but we are aware of it. I think it comes up here locally because of chronic fatigue syndrome, which Lyme disease has certainly been possibly attributed to. In that situation, it's a tricky diagnosis. There's a lot of controversy with attributing Lyme disease to chronic fatigue, so that's really the reason it comes up here a lot in Southeast Texas.
Okay. What would cause your feet to go numb while you're running? Old shoes, had it happen, bought new shoes, and it's still happening?
Yeah, a lot of times you can get nerve pinching in the foot when you walk or run. A lot of times it has to do with degenerative joint disease of the foot. So as the foot changes anatomically, it can start to pinch the nerves in the foot. Again, might have to go see our local podiatrist, get some shoe inserts, maybe even try different tennis shoes. As you know, there are different brands out there, and they construct the shoe a lot differently. Maybe not run as often, maybe do an elliptical or something recumbent where you're not pounding the pavement.
Yes. How about tying your shoestrings too tight, cutting off circulation? Is that possible?
Absolutely. You know, I'm a runner and sometimes I do that, but the top of my foot gets real numb, so I know that's a little bit too tight, so just kind of common sense on that one.
All right. It's been 5 years since my prostate was removed, was discovered at an early age. I was 50 at the time. Yearly PSA since surgery has been less than 0. What are survival rates?
I'm assuming this person had prostate cancer. I think at this point the survival rate is outstanding. A lot of times when you catch it in an early stage, a lot can be done and your prognosis is good.
Explain renal failure and how it can be prevented.
Renal means kidney, and a lot of times in the hospital especially, it involves dehydration. Medications cause that. Sometimes blockages of the circulation, high blood pressure, diabetes. So it's a matter of trying to address those issues. It is very common. So stay hydrated, get your kidney function checked periodically.
All right, let's take a quick time out, and when we come back, more questions and more answers with Dr. Levine. Stick with us. We are back with Dr. Levine to answer more of your questions, and here's a good one for you. A 50-year-old female with neck problems. Left arm has started going numb. No heart problems, though. Could the neck be causing the arm tingling?
Yeah, absolutely. We talk about this a lot on this show. Degenerative joint disease of the cervical spine. As it progresses, the nerves become pinched and irritated. You can get more pain symptoms, weakness. So a lot of times we can treat that with injections, seizure medications, which help with nerve pain. Sometimes we need surgery.
Does that come with age?
It does come with age because our musculoskeletal system does age, and unfortunately, because our society relies a lot on certain types of food and beverages, and we're overweight, we're sedentary, that can progress the degenerative joint disease a lot faster. You can have more symptoms, smoking being one of the biggest ones.
Okay. Diagnosed with hepatitis C in 1975, no flare-up since then. Should this person take interferon shots?
Absolutely. I think hepatitis C, hepatitis B have come a long way. There's a lot of good treatments for that. It's not for everyone because the side effects can be unbearable, but certainly I think you deserve an evaluation and treatment with a hepatologist or an infectious disease doctor who does it on a regular basis because it is preventable. If hep C is not treated, your chances of developing liver cancer and cirrhosis are pretty high, so go get treatment.
Interferon. What is that?
Yeah, it's a very powerful, strong medication. Chemistry class a long time ago, but
Right.
but it's a good medication, class of medicine that helps fight the virus and keep it suppressed for a long period of time.
Okay. I didn't mean to put you on the spot.
Oh, that's okay. I'll do what I can.
Yes, I know you do. Can you get shingles more than twice? And how long do the symptoms last after the pimples go away?
Absolutely. You can get it frequently. That's why we like the shingles vaccine for those who've been infected or people 60 and above. Certainly, the medications work very well. Sometimes patients can be on suppression therapy.
Okay. Steroid injection in the neck in June. Now the left side tingles. Are they connected?
Probably so. Again, the steroid injections are for focal pain. It doesn't get rid of the anatomy, so the DJD is still there, the nerve irritation is still there, so it can progress, which is why you might need surgery, but I would probably go for another steroid injection.
I did a steroid injection living in Austin for allergy issues. It seemed to clear it up.
We love steroids. I use it all the time in the office for just about everything. I think if you come in my office, I'm probably going to give you a steroid injection. But it's just, it works very well. It's been around for a long time, and there's so many issues that can be treated with steroid injections, different from anabolic steroids, which we hear so much about from the athletes. This is a different type of steroid. And some people can't tolerate these steroids, but I at least try it on most patients, and most people really love them.
Okay, so we get a couple more questions. I have a red mark on the side of my face. It is sore and doesn't go away no matter what I put on it.
Certainly, this needs to be evaluated by your primary care physician or dermatologist. A biopsy may be necessary for that.
All right, how about this one? It sounds simple enough, but of course it could lead to problems. Why do I have this constant thirst all the time?
I think here in Southeast Texas, diabetes would be on the top of my mind, but we were talking about it before. Dehydration. It's hot. People are outside, so I would certainly not let that go. Get that checked for diabetes, but drink plenty of fluids.
All right, thank you so much for being in this week,
sir.
as usual.
Absolutely.
Terrific job answering all that, and some good insight that I certainly learned something new today as
Glad
well.
you liked it. Yes,
Thanks,
sir.
Dr. Levine. Appreciate it. We'll be right back. And of course, you can ask your medical questions every Monday by posting them on our KFDM Facebook page. You can also mail them to the address listed on the screen. Email them to us at laf@kfdm.com or call them in every Monday in our Ask the Doc segment.